Welcome to this video on Pap Smear. Myself Noorul Vajiya A, Tutor cum Physician Associate, Department of Physician Associate, Yenepoya School of Allied Health Sciences, Yenepoya deemed to be University. The specific learning objectives are, at the end of the session, the audience will be able to define Pap Smear, list the purpose of Pap Smear, explain the patient preparation and describe the procedure of Pap Smear. Let's move on to the introduction. Pap smear is nothing but a cytological screening test which is used to detect any cancerous or precancerous changes happening in the cervix. It is done by collecting the exfoliate cells from the squamous columnar junction of the cervix in order to identify if there is any cellular abnormalities. The purpose of this pap smear include to detect early signs of cervical cancer, to find precancerous changes happening in the cervix. It is a follow-up after the treatment of any cervical abnormalities, and it is used to determine the estrogen activity related to menopause. When to do this pap smear? Women who are after the age of 21, or the women who becoming sexually active within 3 years. Then the women between 21 to 29 age group, every 3 years of pap smear has to be done. When the age group of women between 30 to 65, every 5 years of pap smear along with HPV co-testing, or every 3 years of pap smear alone has to be done. And after the age of 65, the pap smear screening test can be stopped if the previous tests were normal and there is no high risk. Now we see the patient preparation. The appointment has to be given 2 weeks after the first day of their menstrual period, or the 14th day of their cycle is considered as optimal. The women should not use any vaginal medication or any contraception, or should not involve in any sexual intercourse 48 hours before the sample collection. Instruments used on pap smear: an examination table with foot support in order to position the patient in lithotomy position, and a speculum to visualize the cervix. Then for sample collection, cervical spatula and cytobreast is needed. Then liquid based cytology container. Pre-procedure, inform and explain the procedure to the patient. We have to inform clearly about the procedure to the patient, and after getting the consent from the patient, we have to advise the patient to void. And after providing privacy, the patient will be positioned in lithotomy position and the proper draping has to be done. Then coming to the procedure, we have to inspect the vagina if there is any abnormal discharges or any ulcers or any growths are there, and then we have to insert the speculum by lubricating it with the warm water, and the water should not be too much hot, and we should not use lubricants like KY jelly, Vaseline or Surgilube to lubricate the speculum. The speculum has to be lubricated only with the warm water. After that, we have to insert the speculum with the blades remain closed until it is fully inserted. Once the speculum is inserted fully, the blades has to be opened in order to visualize the squamocolumnar junction of the cervix. The squamocolumnar junction of the cervix is identified by its a pink cervical skin and a red endocervical canal. It is considered as the key portion for the sample to be taken because it is most likely the site for dysplasia. Using the AS spatula, sample will be collected. It is a wooden stick consisting of a concave end and a convex end. The concave end is to fix the cervix, and the convex end for vaginal wall and vaginal pool scrapings. Then the sample will be collected by using the concave end. It has to be rotated 360 degree, and we should not use too much force because it can lead to bleeding and pain, and too little force should not be applied because it may result in inadequate sample. Then with the cytobrush, the sample will be collected by inserting the cytobrush approximately 2 cm until the brush is fully inside the canal, and it has to be rotated 180 degrees, otherwise it will cause bleeding. After taking the sample, it has to be applied as thin as possible over the glass slide, and it has to be sprayed with a fixative, and before packaging it has to be allowed to dry fully. So after the procedure, we have to observe the patient for any vaginal discharge, and if needed, perineal care has to be provided, and we have to assist the patient to change from lithotomy position to supine position. Once the documentation is completed, the specimen will be sent for laboratory along with the requisition form. As a summary, Pap smear is nothing but a cervical screening test which is used to detect any precancerous or cancerous changes happening in the cervix. It is involved by collecting the exfoliate cells from squamocolumnar junction of the cervix, and it is recommended for the women starting at the age of 21 and has to be applied for follow-up intervals based on the age and the risk factor, proper patient preparation, use of specific instruments like speculum, spatula and the cytobrush, and collection technique is essential for accurate results. Post-procedure care and proper sample handling ensures reliable diagnosis. These are my references. Thank you.